Produced by Victoire. Victoire gives a special thanks to the EWF, Empire Wrestling Federation, and Mr. Jesse Hernandez, as well as SoCal Wrestling TV. Find the app on Roku. Hello, everybody, and welcome back to Stylin, the podcast. I am one of your co-stars, the Master, Amir, along with my co-star, WWE and AEW superstar, former WWE Tag Team Champion, ladies and gentlemen, the stylist, Rico Constantino.
Hello, everybody, and welcome to today's show. I'll tell you what, it's going to be a barn burner. I am so excited. I'm so excited for our guest. Our fans have been asking for advice like this, and now we're going to give it to them.
That's right, fans. We've got our special guest here today. But before we make the introductions, Rico, what would look good to you and I?
How about you lay the smack down on that subscribe button and hit the like while you're at it with your friends. Come on, grab a drink, sit with us, and have a chat.
Absolutely. Share with your friends and family. We greatly appreciate it. Now on with our guest. We have been advertising this for quite some time. Ladies and gentlemen, please welcome Jillian Hefferton from Care Esthetics of La Quinta in California. She is our hormone therapy specialist. She's an RN also. Jillian, welcome to Stylin.
Thank you, Rico. Thank you, Amir, very much for having me on and for allowing me to talk about something I'm very, very passionate about. And if I can help people understand the hormone and wellness trajectories, that's what I'm here to do today. So thank you for having me on.
Yeah, absolutely.
Great to have you.
It's an absolute pleasure, Jillian. But Jillian, before we get into the hormone subjects, let's tell the audience a little bit about your background and also where did this passion for wanting to work in this field come from?
Thank you. So being a nurse for over 15 years, I worked in many different areas of nursing that I wanted to try just to get a good knowledge base of, health and wellness and how, hospital treatments, outpatient treatments, ambulatory care, management. So the bulk of my nursing career has been in oncology. So I was an oncology nurse specialist for many, many years. And what I saw from that is most of my patients would get better, which was very rewarding. I did lose a lot of patients as well, but you just see in and out of hospital, just people not getting the wellness that they really deserved, and not people just not getting better. And I started working in an aesthetic clinic with a functional medical doctor who was an ER doctor for many years and turned to functional medicine because he also saw in the hospital how people just weren't getting well and it frustrated him. So he pursued the functional medicine side of things and delved deep into hormone health, which we're going to talk about today. So I started working under him and became very, very interested in what I saw, how he treated people with hormones and how they got better, whether it was male or female. They really, really did well. A lot of their symptoms were relieved, but also for preventative measures. We don't always use hormones just for symptoms, but we use it for prevention, and we'll talk about that too. So having said that, I decided that he encouraged me, Dr. George Rice encouraged me to get certified in hormone health. So I've been certified through WorldLink. It's worldwide, through Dr. Neil Rosier. He's an amazing, amazing physician and a hormone expert. And so I was trained as an advanced bioidentical hormone replacement therapist. And that's what I bring to the clinic here in La Quinta in California. And I'm happy to see people at our clinic. We do free consults, and then I have programs that I see people for where we do labs in clinic. And then I look at the results and I make recommendations, and based on the recommendations, prescribe what's needed for prevention as well as symptom management.
And
Absolutely.
we talk about prevention as well, Rico, functional medicine, and to
Right.
distinguish between the two. Jillian, you and I had a conversation the other day. There is a certain time and place for what I would deem mainstream medicine, with the hospitals and things like that. But if you can explain a little bit more for perhaps somebody who doesn't quite understand, like preventative. So we're going into hormone, we're going into perhaps maybe more the holistic route of medicine. So explain a little bit about that so that viewers can understand that.
Sure. Well, and as we know, hospital care is for a time and a place, like you and I did talk about. So you've been in an accident, or you've got a broken bone, or a severe septic infection, or surgical procedures. That's what we know hospitals are very good for, to take care of those issues. But any chronic type of symptoms, a hospital's not going to take care of that. It's just simply not going to make us better from that. And as we know, people will go to their PCPs and they'll have an issue, and the doctor may prescribe something for that issue. And we know that that medication could possibly come with long-term adverse effects. And then what happens? Then another prescription is added on to that, which again may cover the pain or whatever issue they're having from the first medication they were put on. And it just cascades into this whole uh, medical system issue, which people just don't get better and they stay chronic. So, with hormone health, and as we know, as men and women, we all produce hormones, and all the same hormones. Women just produce more of something as men produce more of something else. And so, in the preventative realm of health and wellness, hormones can be a great um, addition to someone's health that replaces something that we simply had when we were younger.
Hmm.
We lose
Mm.
as we age. So people would come to me very fearful of hormones. And there's a reason why people became fearful of hormones, because of a study which we'll, I'm sure, talk about back in the 2000s, the Women's Health Initiative, that caused physicians to pull all people off their hormones, specifically women,
Hmm.
because of that one study, which has had a lot of invalid and flawed data that we're now seeing out there. But for the preventative part of things, when we lose our hormones, we're looking at cardiovascular risk factors, heart and stroke. We're looking at Alzheimer's and dementia, so brain health. That
Wow.
can really be decreased. We're looking at bone deposition, how that starts to be decreased, and our muscle loss, sarcopenia. We're looking at skin health starts to change, hair loss, and so forth, even gum and teeth problems.
Hmm.
If we don't optimize, we like to use the word optimize, not too much, not too little. We like the right amount of hormones in someone's body. Uh,
Mhm.
so that's where I come from, is that I will see somebody based on symptomatic and for preventative measures. And we look at those things and talk about that in health and wellness.
Yeah, it's truly amazing. I've heard of that before. And you've heard contrary to that, because sometimes I've heard, or at least I've read studies, I'm sure our audience has too, where they say, oh, too much testosterone is going to cause a heart attack, or, or something like, or we see the mainstream medicine, they give us these markers. I think it's if you're at total testosterone of two, if you're a male, 200 to 900 is just fine. And but yet we know that sometimes, I mean, even a man who has a 500 count or a 600 count could be a sniveling, depressed,
That's right.
shadow of his former self. I know for myself, I've personally been there, so I can attest to what a decreased level of testosterone feels like, and it does not feel good. Getting things accomplished can be a complete drag. Even getting the motivation to want to accomplish and quote unquote conquer whatever the obstacles are becomes a drag too. Rico, I'm going to let you jump in right now because obviously, Rico, you and I both know about the prolific use of anabolic steroids in professional wrestling.
Oh
Uh,
yeah.
it's been associated with it for years and years and years. But Rico, before we go into the hormone section of the discussion here with Jillian, have you got anything you'd like to bring up?
Well, yeah. I mean, you when you were right with the hormones going down and you lose all your drive and your go get 'em and stuff like that. And that doc, does that happen around 40, 50 in between there?
Yes, but we're starting to see levels in 30-year-old men that are lower than what we like. And, Amir and I have talked about this due to environmental factors, the foods, the lack of nutrients in our soils, and the dietary and lifestyle factors that people are now living. So we're starting to see low doses, 30s, 40s. Yes.
Yeah.
Yeah, I at 40 I debuted in WWE. That's when I got on TV and I didn't feel the struggle then. But after I got out when I turned 50, I started to feel it go down a lot. And I went for testosterone replacement therapy and under a doctor care and I was getting a shot and I got back that drive
Yeah.
and I felt like me again, not like a hollow me. I felt fulfilled and I was accomplishing things again.
You felt like a man again, didn't you, Rico?
Yeah, yes, I did.
Yeah.
Yeah,
Yes. And I tell you, and I honestly, anybody, I encourage anybody out there, who, because I feel often that people are labeled, like maybe you're depressed, that maybe there's a mental issue going on with you. It may not be that. It may just simply be your hormones are out of whack. So, you go and test them. But again, of course, you've got to know the right tests to take, which
right.
brings me to this particular point. So, Jillian, obviously, of course, we are in California. Care Esthetics of La Quinta is in California. However, correct me if I'm wrong, if anybody in the state of California was to come to We Care Aesthetics, they could be prescribed in this entire state, correct? Even if they were in San Francisco and they had to do a Zoom call with you guys, but you got their labs, you could still prescribe them what they need, correct?
You are right. As long as they are a patient or client, we
Mhm.
like to say at our clinic here, and we're able to get them the labs that I recommend for hormone health, then we're able to treat. So most of our clients come from California here. Out of country, it's more difficult because we can't regulate things. We can't send things to them necessarily
Mhm.
cross border, as well as trying to get them the labs.
Right.
So, but anyone can come to beautiful Palm Desert, Palm Springs, La
Yeah.
Quinta area here in California and come and see us. And we can do the program with them here. They can take everything from here and take it home with them.
Yeah.
And we can do Zoom calls to monitor and tweak whatever we need to do over the phone.
Yeah.
So, yes, travel down to California. You'll get the sunshine too, the vitamin D hormone.
Yeah.
Vitamin D.
Yep, absolutely.
We
That's it.
talked about that.
Yeah, we talked about that. It's a great, yeah, make it a little trip. We'll put a link in the description of this video, audience. So if you are interested in this, in hormone health, then get in contact with Care Aesthetics of La Quinta. And yeah, like you said, you can make a trip of it. You can come out here. It's always pretty much 95% of the time gorgeous weather out in the Palm Springs area. And another thing I do want to stress, if anybody is stressing, thinking, oh my gosh, how much is this going to cost me $20,000 or you're completely wrong. We won't divulge exact numbers right here, but I will tell you that this is one of the best, most reasonable hormone management groups that I've ever come across. And I have been a stickler. I have researched many across from Los Angeles all the way out here. And this is a fantastic treatment protocol treatment, and it is affordable for the majority. So definitely check that out. But before we go into the more specifics, Jillian, what can people do naturally? Things that may be common sense that may improve the quality of their hormones. Any free tidbits that can start them on their path.
Well, that's a good question too. And lots of people ask me that. What can we do naturally? What foods can I add that are increase my hormones? And the simple question is not a lot. Yes, you can take pumpkin seeds. Yes, you can take maca powder and try all these things. But what we're really looking at is serum levels
Mm,
the blood. So we're looking at these hormone levels in blood, and that's why I test, I don't guess. I want to see what your numbers look like. I want to see what your blood looks like. We can also do Dutch test, which looks at how you metabolize your sex hormones and your cortisol levels, which is really important to be balanced.
Mhm.
Um, so having said that, as long as you're living a healthful lifestyle, so you're getting whole foods, you're trying to stay away from carcinogens and environmental pesticides and herbicides and all these different xenoestrogens that are out there and exercising. Exercise is a great way to boost testosterone levels.
mhm,
So, and again, we're looking at serum levels, so you'll get a little bit of a boost. But otherwise, replacement is really what we see to increase those levels in the blood that we like to see. That does provide the best benefits.
mhm. We
Oh, excellent.
definitely, Rico, we definitely see that a change in the environment because I know for a
Yes.
fact when I was younger, and of course, you know, when you were younger, I think back to my dad. I think back to the adults around me at that time. And to me, these men were a lot stronger, you know, Rico and Jillian. They naturally held more muscle mass. They were naturally more when I say aggressive, viewers, I don't mean aggressive in the sense that I'm going to rip your head off. I mean aggressive in the sense that they got things done.
They took charge. A take charge personality, get it done. They were focused.
Yeah,
You know,
yeah,
not fly by nights.
yeah.
Yeah, my
And I
father
think
was the same way. Go ahead.
you're right. And I think what we have to remember too is when you look at pictures and you see them on Instagrams, and when you look at pictures of the 1970s and the way that people looked in their bathing suits on the beach, as opposed to what that same age of a person now, we were playing outside, we were running around. We had lots more hormones because we were getting more pasture raised dairies and real eggs and less
Yep.
of the chemicals that we're seeing now in a lot of our food products.
Hmm.
And um, people just were more active. And we didn't have the technology then that we have now.
Right. Yeah.
Nope.
Yeah.
Addicted to technology back then. We were out playing.
Hmm. Hmm.
Yeah, my,
And the
my mother
sun,
told me, do not come back until the street lights come on. And
that's
in
right.
Las Vegas, I was a desert rat. I had lizards, horny toads, running around the desert, building little forts, and when you needed a drink, you didn't go home. You went to the neighbor's house and
That's right.
drank out of the hose.
Yep. Yep.
We weren't
Yep.
allowed back.
Yep. You built
And
up
then when
your
we came back and took a tub, it was mud bath because we were all dirty.
you
But we
built
were
up
outside playing. Yeah.
you built up your immune system, but also you were getting that important hormone, vitamin D. And
Yep.
we know that the sun does increase testosterone, correct, Jillian? The sun will also, to a point.
Well, the sun will, we need the sun in order for the skin to be able to absorb that hormone vitamin D, to be able to increase the D levels in our bodies so that we have enough of it to help prevent some of the chronic diseases that we see from low levels of vitamin D, like our neuromuscular, like MS and lupus and fibromyalgia type of chronic
Ooh.
diseases.
Mhm.
So, whether it increases testosterone, I'm not sure about that. I haven't read the studies about that, but basically, like I said before, replacing with the bioidentical natural hormones is probably the best option.
Okay. Rico's just drifted off set right now. I presume he's actually getting pretty hot under the collar right now. That's what he's
Yep,
got
I
to do.
am.
Yeah. Yeah. He's taking his jacket off, viewers.
Time to take the jacket off and hang it up.
So, but Jillian, obviously now we've covered the basics. Let's talk about anabolic steroids here. It was a taboo subject for many, many years, but then a lot of bodybuilders came out. More notably, I think there was a guy, I think his name was Boston or something. And he was a young man that would come out on YouTube and just famously inject himself with everything under the sun,
Oh my
telling all the
gosh.
telling all the youngsters out there, oh, this is great. I'm 280 pounds. The guy's dead now. I don't even think he made 35. He was taking everything under the sun. Obviously, anabolic steroids can become an addiction for some, not everyone, for some. But explain what happens, Jillian, when someone takes an anabolic steroid so they really know and they can understand what's happening, why are the muscles expanding so fast, but then also what's that doing to the other organs, such as the heart, because the heart is also a muscle.
Yeah, and anabolic steroids is this in its synthetic form. It's not bioidentical. And so when people were taking this, I mean, it's off the black market. We're not sure where they're getting their doses from and what's in that testosterone. But what the anabolic steroid does is that it can raise your cholesterol levels and lower the HDL levels, which is your high density lipoproteins, which we consider your good cholesterol levels, that it thereby increasing the cardiovascular disease. It also can create peripheral vascular disease in the arteries. And then if people are gaining muscle too fast, that's hard on the metabolic system as well. So we're getting a lot of these synthetic hormones that are actually doing more harm than they are good. However, yes, you'll bulk up. Yes, you'll build muscle and probably very quickly. But the detriments of the anabolics are greater than the muscle building itself because of the cardiovascular disease risks.
Yeah, because
That's just like it,
It can really increase mortality 50%.
wow,
it's just
50.
like a prescription. Every prescription, they say, "Oh, this does this. It's good for this," but these are the side effects. And
Yeah.
Mhm.
sometimes the side effects are worse than what you got.
Yeah.
Yeah,
Like
yeah.
like Doc said earlier, you're on one medication and something happens to your body, and then they put you on another medication to fix that, which this one's trying to fix this. So they
Mhm.
just keep stacking it, and then next thing you know, you got 6 or 7 prescriptions you got to take in order to get a normal feeling.
Yeah.
And
And
you become that what we call typically we see this happen in the elderly is we call it polypharmacy.
Wow. Okay.
Oh, it's one drug on top of the other to fix the other thing and the long-term effects that cause from that drug and so on and so on. So,
yeah,
really trying to help people taper back some of those medications and maybe adding some of these, depending on what their health status is and what they're looking at their serum levels, their labs, what we can do to help them hormonally. And, we talked about the anabolic steroids. The benefits of bioidentical testosterone is that it lowers insulin resistance. It helps to raise good markers like our cardiac markers of our APOA. In
What is APOA for the viewers?
so it's one of the markers that we test. We have APOA, APOB, and lipoprotein A. Those are really great cardiovascular markers that we're now seeing practitioners doing lab draws for those because they're a real good indication of what your true cardiovascular risk will be. So
Okay.
the lower your LP little a is, the better. We can get it less than 30, less than 18, perfect. Your LP, APOA is the good marker that we want higher than the APOB. If the APOB is high, then we worry that you're more at risk of a cardiovascular event, heart attack or stroke.
Gosh. Yeah.
So when I do labs, those are the three markers that I'm looking at. I'm not looking at just a basic lipid panel because, I'm not looking at LDL and just triglycerides and HDL. I'm looking at a whole factor of cardiovascular markers that are true indicators.
hmm
So with bioidentical testosterone, as opposed to the anabolics, we see a lowered cholesterol levels, lipid levels. We see an elevated HDL, which is what we want. So we want a good triglyceride level. I like it between 40 and 60. And we want to see an HDL level about matching your triglyceride levels.
Okay.
So if we look at triglycerides with an HDL and we look at that ratio, if it's less than 1.5 ratio, then you're doing pretty good.
Okay. So,
Okay.
so with another thing that I know with the anabolic steroids, Jillian, is obviously it's a synthetic.
Yep.
So when you put steroids into your own body stops producing natural testosterone, correct?
Correct.
Okay.
Correct. Yep.
Okay. So what are the risks in that of doing that on and off and on and off over and over again?
Well, again, it's hard on the heart. It's hard on the organs to be doing that. And your body gets so confused that it's not sure what it's going to produce. So with the anabolics, then you're shutting down again your own production of some of the other hormones, like your estradiol, which is still really important for a man.
Hmm.
And so is progesterone at their specific levels, not as high as what a female would have. But when you when you take the anabolics and you're lowering your own testosterone levels, shutting that down, then again, you're at risk of that insulin resistance and cardiovascular diseases. And not only that, but inflammatory markers, our interleukin 6 and 10, and our CRP levels. We're looking at some inflammatory markers that start to go up as well.
Hmm.
So we want to be, there's, advantageous and there's negatives to the anabolic steroids. The advantageous is, yes, you build muscle. Yes, you're going to get really good and strong. You're going to feel that. But the negative also affects mood.
Hmm.
Call it the steroid rage. And I've seen that. We can have hair loss.
Yeah.
We can see a lot of different things that happen as far as it converting to estrogens that may sit in the visceral area of fat of the abdomen. So you put yourself at risk when you're taking the anabolics over the bioidentical, which is identical to what your body produces naturally. And
Yeah.
that's what I like to replace with. So if I could get, everybody off the anabolics and come see me and we'll do your labs and we'll get you optimized on the bioidenticals, then
Yeah.
I think we'd see some really good health of these wrestlers out there.
Yeah, yeah, oh, I think so. And also just to, put some fears to rest,
Yeah,
if you were to do the right dose, because you told me the other day, and I won't divulge here because this was, our private conversation, but you told me about my levels, for example. So I know the levels that we can get to safely before we start seeing any issues. So you can still maintain a good physique, a great physique. Of course, another topic I want to get into is, of course, the growth hormone therapy, which is in conjunction with the testosterone replacement therapy. So they can still maintain that wrestler physique, correct? Let's
that's right.
okay. Yeah,
Absolutely. Yeah.
yeah, yeah.
Yep.
So
It's just a conversion. It's just a switch. Now, depending on how long they've been on the anabolic steroids and what it's done to them cardiovascularly, I'm not sure.
hmm,
But the sooner that we can get them, onto a better preference of hormones, the better that'll be for their health and
yeah,
longevity.
yeah.
Yeah.
Rico, let's talk a little bit about that for a second. Give Jillian a chance to catch her breath.
Well, I
So
could go on about this all day.
oh, we
Talk about
will. We're coming back to it, Jillian. But talking about the mental side of things here, because I want to hear from you. I mean, obviously, I'll share my testimony after this when I took steroids. Mentally, what did you feel like in those younger days when you were taking it? Did it change you mentally?
It changes. Yeah, you do change mentally. I had a long patient fuse anyway, and the way I was brought up and taught patients manners and stuff like that. So it took me a while to get edgy or aggressive. But I did know when I was on cycle and off cycle. I knew when I could get irritated faster.
Hmm.
Yes, I got strong. Yes, I got big and stuff. But yeah, it does mess with you mentally.
Hmm. Yeah.
You got to keep yourself in check.
Yeah. Yeah, because I've noticed something, Rico and Jillian. I've noticed some guys, and I won't mention the bodybuilder's name, but there was a pro bodybuilder that I was going to do a documentary with about 9 years ago. Big guy, former Mr. Olympia kind of guy. He wasn't Mr. Olympia, but he was in the lineup. He was in the top five quite a bit. I noticed he was doing a comeback, and he must have been taking everything under the sun because he was getting huge. But if you were to watch an interview with him off of all of this, totally different personality. When he's on it, he can barely talk. It's almost like he became like a zombie. And my wife was telling me something about, like, when they take too much or when they're eating too much protein, it can start affecting the brain and the cognitive function of the brain, where in a sense somebody does start acting dumber. I mean, I hate to say it as blunt as that, but is that a thing, Jillian? Can that be a side effect, too much in the brain?
Absolutely. It can, well, low testosterone levels cause brain fog and memory loss, depression, and mood swings.
Okay.
So if you have an overproduction of it, again, we call it that road rage or steroid rage. And it's the same, anabolic steroid is really not any different than taking like a steroid that we give you if you have, say, you've got some kind of chronic disease and we put you on dexamethasone or prednisone. It's the same kind of feeling once you get high doses of it.
Hmm.
And you start to get that agitation, aggravation, and the mood starts to swing.
Hmm.
So we do see that with too high doses as well. So we have to have that optimized dose there with the correct type of hormones.
Yeah.
Mhm.
And then also with hormone therapy, again, it's far more extensive. When you're taking anabolic steroids, of course, your thyroid's not coming into play here because they don't even think about that. They're just taking steroids. We talked about DHEA, which Jillian put me on a few weeks ago, and I feel fantastic. Thank you, Jillian, for that. It's maybe let's talk a little bit about DHEA. Tell the audience what you told me, what that does for the body too.
Well, DHA is wonderful for both men and for women. And again, as we age, our levels start to deplete itself, um, just due to age and again, lifestyle, environmental factors. DHA is produced by the adrenal glands in both sexes. It's derived from cholesterol. Um, and DHEA, just like all the other hormones, are very beneficial, natural steroid. It's considered an androgen, or what we say male hormone, due to its ability to convert into testosterone in women. In women, it can convert, but not so much in men. But just as with testosterone, females make DHEA too. So it's the most abundant steroid. We call it kind of the master steroid. And what it does is it kind of help regulates the other hormones in the body. So as we add DHEA, as Amir came in and was talking to me about what he's been doing, and I said, let's add, the DHEA in there to see if that can regulate things. It give you just a little boost, like we said, not as much in men. We see it more so in women. And see if that helps. So it can help with insomnia. It can help with your immune system.
Mm.
So it's actually, we use it. It's FDA approved for treating like fibromyalgia and lupus,
Oh,
um, rheumatoid arthritis. It's very good for rheumatoid arthritis. When we get doses to a specific a serum level, it can be very effective for these neurodegenerative diseases. So we like good levels up there. And its ability to shift the body from a catabolic state to an anabolic or protein building state is quite high,
Mhm.
and it can help for energy, muscle, bone, and other important tissues. So what we have to remember is in our body, we have receptor sites throughout our whole body.
Yeah.
So, and as I was explaining to Amir, when we were young, we were flooded with hormones when we were younger. We could jump, we could play hard, we could eat whatever we wanted, sleep and stay up all night, and we didn't feel the effects of it
Right.
like we would now where we don't have the hormones. So when people come to me and they say, "Oh no, my doctor said no, I can't take hormones," I ask them, "Well, tell me why. What's the fear behind it?" And when I start explaining bioidentical hormones to them, not HRT, that's synthetic hormones, we're talking the bioidentical hormones, it's almost like a light went off.
Mhm.
Wow, that's what they can really do? Yes. So I tell people, don't fear them. If we did, we would have all died or got cancer or blood clots when we were young. But
Right.
we didn't. We looked amazing. We felt amazing.
Yeah.
So why should we not feel like that going into our older age?
Yep. 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 That is very, very true. Yeah, Rico, wouldn't you agree?
Oh yeah, especially at my older age.
No, but
Oh,
Rico,
you still look fantastic.
Oh
yeah,
well, thank you.
yeah,
Oh,
yeah.
yes, you gotta say, "You look so good to me."
Yeah.
That was
That
my
was
entrance
that
song.
was his entrance theme once
Oh,
upon a
was
time.
it?
Yep.
Yeah, you look so good to me.
That was his entrance theme. Yep. So,
Wow.
but you speak about receptor sites there because again, I'm trying to calm the nerves of perhaps somebody out there watching this right now who has been taking anabolic steroids. Oh, I don't want to come off. I don't want to lose it. One of the was the receptor sites. We know that when they take steroids, their traps come up towards their ears. It's like a natural reaction for some reason. I don't know. Maybe Jillian, you can explain why that is. But I noticed they get huge traps. Anybody who's taking steroids, it seems like everything floods there. What is that about particularly? What is that? Do you know what that is?
Well, it's probably the high dose of the anabolic steroids because remember, we can't regulate those anabolics. Those steroids, we don't know where they're coming from.
Right.
And they're just so much higher dosing
Hmm.
than what we start you on and get you up to. It doesn't mean the bioidentical TRT, we can't get you up to those high levels,
Mm.
which I like good high levels in men. Well, and
Yeah.
women too, but men typically, they get higher levels than women do.
Mm.
But it's all has to do with the dosing, Amir. It's
Yeah.
just so much higher.
Yeah.
And that's where it's going to sit. So again, the receptor sites are everywhere.
Mm.
But when you're building that muscle strength, you're going to see it probably sitting there. Yeah.
Yeah. Rico, I read a startling a piece a couple of nights ago about some bodybuilders about the levels of their testosterone. And Jillian, I read this too, in excess of 5,000 total testosterone when you're on
Yikes!
anabolics. Now,
That's where it's sitting then.
yeah, now I because I know I've spoken to mainstream doctors and they get sweaty palms when you're at 1,000. Now, we know that even when you're at a teenager, you're way above that. And you're, like you said, the body was able to handle it. So if it was able to handle it then, it can handle it later. Of course, obviously, now, Jillian, there are certain protocols you do have to follow. Of course, if somebody is 80 years old, they presumably can't have a testosterone level of 2,500, correct?
Why not?
Oh, okay. All right. Well, this is why everybody needs to go and visit Jillian and Care Aesthetics of La Quinta right here.
I'm gonna
Um,
go get my plane ticket.
Yeah.
yep. You need to just cross that borderline, Rico, and come on down here.
Yeah.
You can stay
Oh
with
my
you can
gosh,
stay with
I am
us.
learning so much.
Yep. Yep.
And there's
So,
a whole lot more.
yep, we've just literally
Well, then it means
scratched.
you got to come back and inform us. Or do I
I'd
say
be
me?
happy to.
She,
Happy.
she will absolutely. So, Jillian, I want to switch gears because, of course, we've been talking a lot about the males here, and I want to give some light to the females as well. So, obviously, women go through menopause. This is a natural thing that will just occur. Some women, it could happen as early as what, 35, Jillian? Some women, 35, 40.
Yeah, absolutely. Again, just like we see low levels in men in their 30s, we see young women who can have issues starting, yeah, in their late 30s, mid to late 30s, and beyond. Yeah.
Okay. So for maybe for us males, because maybe we'll have a better understanding of our wives or our significant others in this. Tell us what happens when a woman goes through menopause. Just a simple version so the men out there can understand.
Oh, Amir, we're going to need a couple of hours to talk about this one.
Yeah, I know it's a pretty in-depth subject.
For
Oh,
me and I, it's called
quarantine is thinking.
self-preservation.
Self-preservation. Yeah, exactly.
Self-preservation.
Yeah, right.
So,
Well, so as a woman enters her the stage in life, typically the end of her menses is probably around 51 years old. She starts entering into her 50s and she starts losing her hormones. And some women go through it magically and they don't have symptoms, they don't complain of symptoms. And we'll go back to that. Just remember that thought.
okay.
And then there's other women who go through it and they have a terrible time with symptoms. They have the hot flashes, and we call it vasomotor symptoms, where they start with the hot flashes and night sweats, and they start having muscle aches and pains, bone pain, joint aches. They don't sleep. They start to get insomnia. They start to get dryness in specific areas. They lose their libido, unfortunately. Their mood changes. They start to have, eye issues and hearing problems, and even your feet can grow.
Hmm.
Yeah, yeah. Their jaw, their teeth, dental structures may change.
Hmm.
The biggest thing that we worry about women going into menopause is heart attack and stroke. Women are more prone to heart attack and stroke after menopause than any other age group or male. So that's what we really worry about. Now, when I said I go back to the women that say that they don't have any symptoms, and I'm thrilled for women that don't have symptoms, and sad that women who have gone through life for many, 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 many years and have been given a disservice due to the one study, the Women's Health Initiative, that said that all hormones were bad, basically, and that the estrogens and the progesterone were going to cause cancer in women and blood clots. And we know, like I said earlier, that study is now being debunked, and there's a lot of flaws in that study. And in the study, they also were giving HRT, so they were doing Provera and other different hormones that were synthetic hormones. And the age of the groups of women that were in that study were 63 years old. Some of them had already been on hormones, some not. Some already had other chronic diseases to take into factor. So like I said earlier, I don't just treat based on symptoms. I'm treating on preventative measures for men and for women. I don't want you to have a heart attack and stroke. I want to help you prevent dementia and Alzheimer's. I don't want you to fall and fracture your hip when you don't have to, because we can replace those hormones that help with to build bone deposition and prevent the loss. I want your skin to be glowing like you had when you were in your 30s and 40s. I want you to have a libido. I want you to be able to have a relationship with your spouse and not worry about that. And I want each male and female to have good mood and good energy. And the other big thing is insulin resistant.
Hmm.
As women go into menopause and we lose our estrogens and our other some of our other hormones, but particular estradiol, women can become, our cholesterol levels can start to creep up, as well as our A1C levels, which is a long-term prediction of prediabetes.
Hmm.
We can start to see, regardless whether you live a healthy lifestyle or not, you start to see those levels climb.
Yeah.
We start to see the small particle LDL lipoproteins start to increase, those triglycerides. The HDL starts to lower. So I'm treating based on primarily prevention, but to also help with symptoms for our women.
Mhm.
We're starting to talk about hormone health a whole lot more because we've got some really fabulous physicians out there that are starting to talk about hormone health and to replace things for women. Um, and one fun fact is that in pregnancy, when women deliver their babies, and a lot of them have postpartum depression, I always say if I was a physician in that area, I'd carry a shot of progesterone. I would give every woman a shot of progesterone after having a baby, and it would prevent the postpartum depression that these women have and causes a disconnection with their newborn
Hmm.
because they have a lot of mood changes. That influx of hormones, the progesterone drops dramatically, almost to zero after they give birth.
Wow.
So by replacing progesterone, we can use it as an antidepressant,
Mm.
the adverse effects, and
Yeah.
help sleep. And in one study that I was reading, actually, women who do take progesterone, and it is safe to take during pregnancy, the study that I actually read produces in more intelligent babies.
Wow. Yeah, very interesting. Who would have thought that?
So I'm
Wow.
a big
I
promoter
he
for
didn't.
hormones for women. Yes,
Yeah.
yes. We
Gosh.
have to remember that it doesn't work for all, but for majority of women, that's why I do a monitored program, testing their levels and tweaking what we need, and for men and for women to make sure that we optimize them.
It's almost a sad state, isn't it, Rico? I
Yeah.
mean, you think
Yeah.
about like, mainstream medicine, like Jillian said at the top of the show, it's there for a reason. Yeah, if you break your arm or something like that, or but it's not there to prevent these things. And I think a lot has been exposed, Jillian, in the past few years, certainly in the past 4 or 5 years, around the world now. We're seeing that these big pharma companies, they're making billions and
Yep.
billions of dollars, and they're enjoying actually people being sick because without that, they wouldn't be making any money. And they're not again, we're treating the root cause with hormone therapy. That is the root cause. Everything else, it all stems from an imbalance somewhere, something
Yeah.
going awry. So the trick is to balance everything and get you guys optimal, which is what Jillian can do at Care Aesthetics of La Quinta. Oh,
Oh, there you go. Global.
I have to talk about this because for a second and give credit to this physician. This is our Normal is an Optimal, and by Dr. Neil Rosier, who has been an Emerge doc for many, many years, and he treats a lot of his patients with hormone optimization therapies. But he trains through his company called World Link, and it's worldwide. There's physicians from all over the world, not just ED docs, but cardiovascular physicians, urologists, hematologists, oncologists, OBGYN, nurse practitioners, physician assistants. Even there's dentistry. When
hmm.
we lose bone in the jaw, we're losing estradiol. When we replace estradiol and some other simple supplements that I recommend when I check for their bone deposition through a simple urine test, um, we see some dental issues as well.
Mhm.
So when they're going for dental work and maybe they're having a root canal and that root canal is not healing and the bone structure is not strong enough to put a tooth in there, that's loss of hormones.
Wow.
Hmm.
Rico, I'm being blown away right now. What about you,
I
Rico?
am. I'm just listening. I'm soaking it in like a sponge.
Yeah.
I'm learning so much.
Yeah. I mean,
Oh,
I often think about it. I was shown a picture the other day. My wife showed me a picture of somebody that she knew when they were younger. And she said, "Who do you think this is?" And I kind of knew because I could barely make it out in the eyes. But that person's entire face, the bone structure and everything now, what, 30 years later or what, something. It doesn't even look like the same person, Jillian. But now it explains, because they're plagued by ill health, sadly. I pray God bless her, yeah, the structure's changed. You can barely, I mean, if you didn't know who she was at all, you would say it was two different people. I was not aware that the bone, even the bone, is affected by hormone health, which explains a lot. If you take hormone therapy, if you catch it on time, you can preserve. So people, when you are 70, 75 years old, I saw Dennis Quaid on the news, in fact, last night, and I'm pretty certain that he is doing hormone replacement therapy. But yeah, you can still see, again, facial structure, Rico. He's still in shape. Obviously, he's not going to be in the shape he was in his 20s, but
Well,
he doesn't look, I mean, for 70 years old or whatever he is now, it looks pretty darn healthy, pretty darn good. So, wow, I didn't know that.
Well, yeah, and
Fantastic.
there and Amir and Rico, there's so much more, hormones and cancer prevention,
Mhm.
hormones in preventing urinary tract infections, bacterial infections in women, hormones in health overall, hormones in treating traumatic brain injury.
Oh, which is
wow.
which is going to be, yeah, we're going to talk about that. We're going to leave that one as a cliffhanger. So for any wrestlers out there that have suffered concussions or any traumatic brain injuries, we're going to delve into that particular topic with Jillian on an upcoming episode. We won't give him everything today, Jillian. We're going to, you got to
We gotta hold back a little bit of information
yeah,
here.
yeah, we got to hold back a little bit. You got to lay the smack down on that subscribe button and come back around here. But
Yeah.
yeah, incredible. I mean, it's just speaking of which, actually, Jillian, I do want to give a recognition now to one of our viewers, Matthew Jacobs from Canada, and he actually knew you were coming on. And he wanted to ask a question because his wife has had breast cancer in the past. They went to an oncologist and asked about hormone therapy because she is in premenopause, and they shot her down right away and said, absolutely not. Now, what do you think about that?
Well, I think a whole lot about that. And the first thing I'm going to say is what we have to remember is doctors, when they're in medical school, they don't get any, they maybe get an hour, maybe a day of hormone health, if that.
Wow.
So they are not abreast as to the hormone information that they would benefit them, of course, in health. But and what I say to my clients, if they come in and they are dealing with any specialist, whether it's urology, oncology, hematology, cardiovascularly, unless that physician, that specialist is literate in hormone health, I say sorry, because if you're seeing a specialist, they're not going to agree with my treatment plan. They will not,
Right.
because they just don't have the knowledge. They
Yeah.
don't know how to read the hormone labs that I test for. And no discredit to them, but if you're working with a specialist, it's going to be hard to get a doctor who's going to agree with what I'm going to tell you. But in all the literature, there's thousands and thousands of literature that testify that when taking hormones, it can be a preventative measure against cancer, whether it's prostate cancer, whether it's breast, whether it's uterine, endometrial.
Hmm.
When women, so in particular to the case that you were just talking about, women who are 5 years out from their cancer therapy, possibly breast cancer, if it's 5 years out, that's when we can start them on estradiol.
Okay.
Mm.
Here's out.
But we wait the 5 years. However, they can still take progesterone and testosterone.
Hmm. Okay.
Okay. So that will help the vasomotor symptoms, that will help them sleep. And progesterone, whether you have a uterus or not, contrary to popular belief, You still need progesterone because I talk about estrogen and progesterone on a teeter-totter.
Hmm.
One's on one side, one's on the other. They have to be in balance, whether there's a uterus or not. Now, when you don't have a uterus due to hysterectomy, you still have endometrial tissue that's lining that wall. We want to prevent endometrial and endothelial type of cancers there. Progesterone helps to protect that and prevent the cancers that will happen in those areas with or without a uterus.
Right.
But progesterone also helps to balance the estradiol levels in the body, and we need that because we don't want an influx of the estrogens in the body. We want to make sure that we balance it with the progesterone.
Hmm.
So that client, yes, if she's 5 years out from her breast cancer, my recommendation is start them on estradiol and progesterone and testosterone, and that can help a lot of her symptoms and prevent reoccurrence of her breast cancer.
Wow. How about that? You know, Jillian,
Wow.
when you say stuff like that, it seems almost criminal now that a doctor would just turn someone away and say, "Yeah, no, you're not going to do that." It's like it's because if there's a prevention, if there's a healing here, just refer. Say go and see a hormone specialist. You know, it's not that difficult. Rico.
Well, they're not schooled in this area. As she
Yeah.
said, less than an hour. You know, you're not going to retain that. You're worried about all the other big words, and you're worried about curing stuff or fixing something.
Hmm.
She's into preventing, getting into preventive. You know, and it all starts from the beginning. You know, you take care of yourself in the beginning, and it works at the end. Like me, I'm still active, exercise, and I'm 63,
Yep.
but I've taken care of myself years before, you
Yep.
know, and now with new technology and what's available, like this TRT, HRT stuff, is really interesting to me because there's days I feel like this and like this, you know, you have your highs and your lows. You know, this hurts a little more over here, you know, too many steel chairs to the head,
Yep.
tables from the Dudley boys, you know, that the check has to be paid at
Yep.
some time. You
Yep.
know, you're just not gonna, I'm not gonna have done everything I've done in my life between, you know, American Gladiators and WWE, you know, and everything in between. There's got a price got to be paid for that. And if I can get involved in this HRT and TRT and find it would ease the symptoms or whatever, or recreate or fix
Mhm.
what I'm possibly could have. That's something I'm very interested into,
Yeah.
you
Yeah.
know, because I want to keep going as long as I can. And still, you know, I eat healthy. Not everybody does. And I remember, I'm going to go back to the beginning of the show, is when I was a kid, we were lucky if we got McDonald's once a week.
Hmm.
Lucky.
Yeah.
Everything was homemade. Mom made everything. It was from potatoes, steak, chicken, everything was there, you
Yeah.
know, and there wasn't so many chemicals in the food.
Right.
Nowadays, everything is fast.
Yeah.
To have it fast, you need chemicals. So if you put it out there, you want to preserve it.
Yeah.
So you got preservatives in food, you know, and carcinogens and other food, you know, and food you just walk to the corner and you can bite the corner store burrito. You know,
Yeah.
people are resulting to that instead of good whole foods,
Hmm.
chicken, eggs, dairy, steak, you know, fish, your omegas. You
Hmm.
know, they're not getting that. They're not getting it because the food that they settle for doesn't have it in it
Yeah.
for you to digest and be part of your body. That's
Yeah.
why all these vitamins are coming out, omega 3s, omega 29, you know, and you're trying to put it in a pill when it should be coming into you through your food. That's how
Correct. As
little
they
our
say,
food.
you're right, Rico. Food is thy medicine, or it's your greatest illness.
Hmm. Yep, absolutely. And I think for the both of you, I think we've reached the conclusion of this episode. That's a lot of information for everybody to think about. But also one thing I do want to stress, Rico said there, everybody wants something fast. Well, think about that too in pro wrestling. Think about that too for your body too. It might be cool to get muscles fast, right? But look at the damage you're doing inside. And also remember, it's going to be a very expensive habit because once you come off, you're going to lose 75% of that within little time. So with the testosterone replacement therapy and doing it the natural route, and especially like I said, I will stress again, viewers, the package that is available at Care Esthetics of La Quinta with Jillian is absolutely phenomenal. You will be monitored for the fee for an entire year. You also get your blood drawn. They know exactly what to draw from your blood, and they'll do it right there. Or again, if you're living in San Francisco and you can't make it down here, I'm sure Jillian, you can send a script over there. Blood, what do they call it? A blood
Lab
Uh,
work.
lab work.
yeah,
Lab
lab.
work.
As
You could
long as
send.
there's a lab corp around or an actually, yeah,
Yep.
yeah.
You can send it out there and send it back in, and they'll read that, they'll monitor, and they'll prescribe for you. Compound pharmacy prescriptions. So again, it is bioidentical hormones. It won't be synthetic. So just your body will be producing more. It'll force it to produce more of what's naturally in there. So I'm correct with that, correct, Jillian?
Yeah, well, bioidentical, we still consider a synthetic form because you can't physically make
Right.
a or
Right.
take a hormone out of your body,
Right.
but it's still in its synthetic form. It's a bioidentical form that is plant-based and naturally replaced to what your hormones were in your body. So we like the bioidenticals. We're not going to talk about the synthetic HRTs because we know they do have risk factors with them. So yes, we will only use the bioidenticals. I start at specific doses and we work our way up to make sure that you're optimized.
All right, perfect. Rico, my friend, have you got any closing comments this week?
I'm optimized.
Thanks
I'm getting
for.
knowledge.
I haven't done your labs yet, Rico.
Oh,
Not
he's
yet.
coming. He's coming.
I got to get there. I got
He'll
to
be
get
here.
there. So, my motto and what I'd like to leave everybody with, and I've lived by this my whole life, and it's what your mind can conceive, your heart can achieve.
Amen. Amen. Absolutely.
Amen.
Amen. Well, Jillian, it's been an absolute pleasure having you as our special, very special guest here on Stylin the podcast. We
Yes.
absolutely we want you to come back. We'll come up with some other topics that we can talk about. And of course, everybody, if you are interested in hormone therapy, I will leave a link, sorry, in the description of this video for Care Aesthetics of La Quinta. But until next time, everybody, keep styling. Lay the
Keep
smackdown on
smiling.
the subscribe button, and we'll see you next week on Styling.